2 years ago, 18-year-old LAVONTE Shaw preferred to be invisible. With an abusive home life and ADHD affecting his ability to learn, LAVONTE ended up homeless. Depressed and alone, he turned to petty crime and self-medicating.
I skipped school a lot, smoked weed, Just the problems I was dealing with at home, the stress, I tried to get away from it by smoking.
Eventually, LAVONTE was arrested and ended up here in juvenile detention. And if something didn't change in his life, he was on a collision course for long-term incarceration. Thanks to a federal grant known as the Seminole System of Care, the Sheriff's Office partners with community-based care to find services for at-risk youth. LAVONTE was directed to Sanford-based Above and Beyond. Now, 2 years removed from homelessness, he's working towards his GED and eventually college.
Without them, I don't know what I'd be right now.
The child has a voice, and I love that piece.
Advocates like Mary Beth Duggan draw on experience from trauma in their own lives to provide so-called wraparound services for youth in transition like LAVONTE, stable housing, job placement, and simple encouragement.
They want somebody that's going to go, you can do this, you can get through this. It might be tough today, but tomorrow's not going to be so bad.
Sheriff Dennis LEMMA sees partnerships with providers within the Seminole System of Care as a cost-effective way to intervene in the lives of young people like LAVONTE.
We've seen the good that it does in the community. It's 10 times more expensive to incarcerate somebody than to properly treat them with assisted outpatient treatment. And that's the direction that we need to move.
Unlike LAVONTE, Allison Gallagher thrived in school. Once a vibrant teen, she enjoyed basketball and got good grades. That all changed, her father says, as she descended into serious mental illness.
Just really thriving. And then as she started to get sick, it really, as parents, we felt lost.
Despite her parents' best efforts, in 2007, Allison took her own life. To honor her memory, the Gallaghers started Allie's Hope Foundation to give struggling parents hope and guide them to resources.
They need to understand they're not alone. Be willing to talk about it. Let's open the closet and get rid of the stigma.
The idea behind this Saturday outing, known as Respite, is to bring children with a mental health diagnosis together and give their parents some time off.
The kids tend to isolate themselves because they feel like they're different, but really they're like any other kid, except for they just have a special need, something that needs to be attended to in an appropriate way.
Muriel Jones of the Federation of Families knows from experience that giving parents a few hours off while their kids have fun helps them reduce stress, one of the many services they offer to children and families on a mental health journey. Maria Aponte, a single mother of 3 whose 14-year-old daughter Isabel is bipolar, says the services have given her hope and encouragement.
I don't know it all, and I want to help. I want help. I want to be able to deal with the situation with the household, and that's what they were able to help me with.
If you or anyone you know is experiencing symptoms of mental health challenges, here's where you can go for help. You're not alone.